A contrast bath is a thermal modality used to decrease pain, increase circulation, and increase oxygen to the muscles surrounding the tissue of an injured area. Contrast baths also reduce soreness, swelling, and inflammation by placing a hand or foot in both a hot and cold water bath simultaneously. Contrast baths are used when there is a non-acute injury to limbs or joints, when there is a hypertoned muscle that are in spasm or cramping, reduced blood flow, and when you are treating joint and mild sprain injuries. Contrast baths can be used as a form of preventative health care for strain injuries that include migraines, carpal tunnel, diabetes, numbing and tingling in the hands and arms, headaches, and thoracic outlet syndrome. Make sure that you have 2 containers that are deep enough to submerge the limbs in water. Have a thermometer handy so that the hot water is between 97 and 111 degrees Fahrenheit, and the cold water is between 55 to 76 degrees Fahrenheit. You should also have a towel handy. Before your client comes in, you should already be prepared for the contrast bath. This should have been previously talked about as an implementation of their intervention plan. Make sure that when they come in, you greet them and ask them what their pain level is. Also, make sure that you check for understanding that the client knows exactly what the procedure is for and how it was done. Sometimes this may include you doing a demonstration of a contrast bath in order to make sure that your client is fully comfortable. It is important that your hand is fully submerged in the water. Make sure that you have a timer handy in order to measure out the time between the contrast baths. Depending on the injury of your client, they may need assistance transferring their hand from one bath to the other. You are there for the client in order to make this process as easy and comfortable as possible. Upon completion of the contrast bath, make sure that you have a dry towel ready. Ask your client their thoughts about the contrast bath. Did they like the hot better? Did they like the cold better? Was there a tingling sensation? Maybe they felt stabbing. This is all important information for you to gather. Make sure that you keep a notebook full of your observations and what you previously discussed with your client. This will help you set up short and long-term goals as well as create an intervention plan for your client. At the end of the session, reiterate the main points of the contrast bath. Also, ask if your client has any questions about contrast baths or about their home education program.